All right, good evening. Thanks for joining us. I'm Kate Lauman, social media consultant for SSM Healthcare, and welcome to our first Google Hangout on air. Now, throughout our Hangout series, we'll bring you experts from across the SSM healthcare system talking about interesting and important healthcare topics. Now, tonight our focus is on headaches and the newest treatment options available. During this chat, we'd love to hear from all of you with your questions. And there are a couple different ways that you can get those questions to us. First, you can email them. The email address for tonight is going to be AskSSM@ssmhc.com. You can also tweet us, our Twitter handle, SSMSTL. Finally, you can post on our Facebook pages, also YouTube or Google+. Answering your questions tonight is Dr. Siddharth Kaul. Dr. Kaul is a board-certified neurologist with SSM Neurosciences Institute at DePaul Health Center, who specializes in treating migraines at SSM's Headache Clinic. Now, before we get to your questions, I would like to turn things over to Dr. Kaul to help us set the stage. Dr. Kaul?
Hi, Katie. How are you? Thank you for having me.
Absolutely. Tell us a little bit about yourself and some background information really on headaches and migraines and the differences between them.
Well, I'm a neurologist here at DePaul, as you already mentioned, and I do specifically, I'm a general neurologist, but I do a big part of my headache clinic. My clinics include headache patients, and we do all sorts of interventions as well as managements for headache patients. You know, headache is a big burden on U.S. healthcare. About 35 million people will suffer from. That's about a third of the population will suffer from headaches at one point or the other in their lives. And a large part of this population is a working population because they're within the ages of 20 and 45, where they're most productive, single mothers, taking care of the kids. There are people who go to the offices every day, nurses, healthcare workers, people who work in business. And these people miss a lot of time because of these headaches, and management of these headaches not only helps with the patients, but it also reduces a lot of economic burden on these, on the overall economy. So it's very important to treat these headaches both from the personal point of view as well as the economic point of view. And that's why we're here today to discuss, what headaches are, what are migraines, how can we manage these things. So, and I really want to touch upon some new therapies that have been introduced in the last few years. So headaches, as I said, 35 million people. A lot of people who suffer from it are between the ages of 25 and 45. And as you see from this graph, about 3:1, it's females who are affected than males. And we think some of it has to do with hormones, but we really don't understand the exact mechanisms. But that's what studies have shown in the past. And before we get into what are migraines, what are the various therapies, I really want to touch base on the important aspect of headaches being something sinister. So if you have headaches and you have any of those red flags that we mentioned here, which is stiff neck, high fever, if you're pregnant, if you have neurological changes in your body, such as weakness of the arm or leg, loss of vision, loss of ability to speak, if you had a head injury, these are signs that you should not take lightly with headaches, because they can sometimes point towards a more dangerous underlying disorder in the brain, such as bleeding, meningitis, stroke, etc. And they should be looked at by a specialist or in the ER right away. But you have to understand that a very small percentage of all headaches will include this. However, it's an important distinction to make. As we move on, we do mention that some people with migraines and aura will have an increased risk of stroke, as evidenced by studies, and especially women who have migraines with aura-like symptoms, which is like blurring vision, strobe lights, flickering lights, etc., which I'll touch upon later. It doesn't mean that everybody with migraines with aura will get a stroke, but this is something that you should discuss with your headache specialist regarding what you can do to prevent this in the future. As we move on, we talk about what are the various types of migraines. Now, one of the important distinctions which you will notice here is that I mentioned migraine as opposed to headache without aura. It's very important to differentiate between headache and migraine. Headache is basically any pain which happens in your skull or in the brain, which is indicative of something going on, something usually not very pleasant going on in your brain. It's an indication by your body to take care of it. So if you have a headache, say, after you hit your head, or if you have an infection, or if you had a stroke, or if you have blood in your brain, that's usually not a migraine. That's a headache that needs to be treated right away. Migraines are headaches that fulfill certain criteria. For example, what you see on the slide here. For example, if you have headaches more than 5 times a month, that's not a regular headache. That's a migraine. For example, if they last for more than 4 hours and up to 2 to 3 days, that's not a regular headache. It's unilateral, it's pulsating, it's accompanied with nausea and vomiting, and there's no other cause that's identifiable, like a stroke or meningitis or bleeding. That's when you actually start talking about migraines, and that's where our talk will delve into. Of course, if you have any other symptoms that we discussed earlier on, your need to go to the ER is very imperative. So migraines can be without aura or with aura. Aura are symptoms, are neurological symptoms that occur because of this pain signal traveling through your brain at a very high rate and activating various parts of your brain. For example, if the migraine, the signals start at the back of your brain, you'll get visual symptoms because the back of the brain controls visual symptoms. So you'll get flickers, spots, loss of vision, etc. For example, if the migraine continues to travel forward, it will hit your sensory part of your brain, and you can get symptoms that are like pins and needles, numbness. You can feel certain water flowing sensations over your head or your face, and those kind of very bizarre sensations. And if the migraine continues to travel forward, unopposed, then you can get motor symptoms, which is basically weakness of an arm and a leg, or loss of speech, or similar stuff like that. So those are migraine with aura, and if you have none of these symptoms, that is migraine without aura. A third very common type of headache, which is perhaps by far the largest type of headache present in the American population, is a tension type headache. These are headaches that exist like a pressure band across your head. They also can accompany with nausea and vomiting, and may not. They don't carry the typical symptoms of migraines, but they usually are just this dull daily headache that you have every day across the whole front of your head, circling back into the back of the neck, and it just continues unabated. A fourth type of headache, which is more rare, is also known as a cluster headache. It usually affects men more than it affects women for some reason. It can be very unilateral. It almost always exists on one side of your head. It can affect your eye, make it red or wet. It can make your nose stuffy and drain. It can droop your eyelid on one side and can appear really very dangerous. And this usually gets you to the ER very quickly. And this requires very acute treatment with IV medications as well as oxygen therapy. And if you do have these headaches, the treatment is slightly different than with the rest of the headaches. But again, like I said, it's a very small percentage of the whole headache population. Moving on, how do we manage migraines? Well, migraine is a chronic condition that does not have a cure, and this should be set up front. However, just like diabetes and hypertension and high cholesterol, it can be managed. And one of the first things that we do with any chronic disease, including diabetes and hypertension, is to identify your triggers. Are you under a lot of stress lately? Do you sleep well at night? If you do sleep, do you get enough sleep at night? Do you eat well? Do you use caffeine? Do you smoke? So these kind of trigger identification is done when you come to see a headache specialist, because sometimes just modification of these triggers can actually help you with managing much of this headache. Just like in diabetes, eating well and managing your blood sugars can help reduce the disease impact. And so most people will be able to modify some of the triggers, and some will not. If trigger modification doesn't help you with the headaches, then we move on to the next step, which is the medications. And some of the common medications that have been used by headache specialists over the years are anti-inflammatories, which is basically aspirin, ibuprofen, all the over-the-counter medications like Aleve and Excedrin migraine, extra-strength Tylenol. These kind of things help reduce the inflammation in the brain, which is one of the ways that people think causes headaches. The other type of management is acute therapies, which is basically, doc, I have a headache right now, what do I do? Well, some of the things besides the ones that I've mentioned before are triptans. These are a group of medications that help reduce certain neurotransmitters or hormones in your brain, thus reducing the headache impact. There are anti-nausea medications like Reglan, Compazine, and Zofran that also regulate the immune system as well as the hormone system in your brain to help reduce the headache impact. And also they help you with the nausea and vomiting that often occurs with these headaches. And then there's the long-term preventive therapies like anti-seizure medicines such as Topamax and Tapaco, or antidepressants like amitriptyline, doxepin, etc., which also help with your sleep. And the the prescription of these medications depends on what the patient's needs are. For example, and this is just an example, if a patient has lack of sleep, we would give him some antidepressants because that would help with sleep and with his headaches, and so on and so forth. And those needs are identified once we speak with the patient in the clinic. Then there are the alternative therapies, which can be done in conjunction with your medical therapy or without it. There are a lot of patients who do not like to take medications, and so for them an alternative therapy would be advisable, such as physical therapy, chronic chiropractic manipulation. Acupuncture is another therapy that has been used with variable success. Biofeedback is often used in large headache centers which have the infrastructure to do it as an effective tool, a non-pharmacological tool to manage headaches. And then there are the herbal medications like butterbur, feverfew, supplements like magnesium, melatonin, and riboflavin, which supplement your natural hormones in your body, thus regulating your sleep, your headaches, and other, the milieu, the internal environment of your body, so as to give you that stability, which keeps the headache levels at a low level. And then we move on to what is chronic migraine. Well, chronic migraine is, in a large population of the 35 million that I mentioned, about close to 10 or 15 million will become chronic migraineurs. And these are patients who keep getting about 15 or 20 headaches a month. Each lasts for about 4 hours. Usually it's for multiple days, sometimes even weeks, and it at least should be there for 3 months. So if you fulfill these criteria, you are a chronic migraineur. And I get a lot of patients telling me that, oh, I get headaches all the time, but they're not migraines. Well, if you have headaches more than 5 days a month and they have lasted for more than 3 months, you have migraine headaches. There is no such thing as a normal migraine or a normal headache. And why this is important to recognize is because this chronic migraine, just like with any other chronic disease, as I mentioned before, can lead to other things. For example, depression. If you're in pain every day of your life, you will be depressed. This is not rocket science. If you have headaches, you can get sinusitis. You're more prone to getting bronchitis. You're more prone to getting high blood pressure because any kind of chronic pain will increase your blood pressure. That predisposes you to other conditions like heart disease, stroke, high cholesterol, etc. When you have headaches, you don't exercise, you don't work out, so it'll lead to obesity, and that will lead in turn to high cholesterol and other things. So chronic migraine, like any other chronic disease, does not live on its own. It brings other things to the table. So what can we do about chronic migraines? And I want to talk here about some new therapy that was recently developed about 2.5, 3 years ago that was approved by the FDA called the botulinum toxin. Now, a lot of you have heard about Botox, which is mostly used for cosmetic purposes, and that's what we hear about in the news. But Botox has very different uses besides just cosmetic purposes. We in neurology use it for various purposes, such as dystonias. We use it for vocal dysphonias, where people have problems speaking, and now we use it for headaches. The principle is almost the same as in cosmetic Botox. We do paralyze or weaken the muscles, but we do it for a different purpose. When you use it for cosmetic purposes, the weakening of the muscles removes wrinkles. In headache, what this does is paralyzes or weakens the muscles that actually contract during headaches, giving you the throbbing sensation or the pain around your head. So what happens is that even though the headache signals are coming from within your brain, they're not able to contract the muscles of your scalp that's giving you a headache. So it takes one component out of the headache paradigm. When you get headaches, there are usually 3 types of things that cause headaches. One is the irritation of the meninges. The other is the dilation of the blood vessels. And the third is the muscle contractions. And that's what Botox takes away. Now, who qualifies for Botox? Does everybody need Botox? I don't think so. So Botox is usually reserved for a group of patients who do not respond to the regular therapy. But I would say about 70% of headache patients would respond to the conservative management of headaches, which is through medicines, biofeedback, and trigger identification. It's about 20% of 35 million, which is still a large population, who will become chronic migraineurs who will not respond to any medications. They still have 15 headaches a month, they fail 3 or more medications, and these people are right candidates for Botox therapy going on. So where do we give Botox? And why do we give Botox? So, studies, when Botox was studied by physicians, it showed that when you took patients with headaches and divided them into 2 groups and gave one group Botox therapy and the other was just given no therapy at all or a sham therapy, the ones who got the Botox did much better than the patients who did not. And then when everybody was given Botox, including the people who did not get therapy, the ones that got it early on did much better on a sustained basis. So it's important not only to consider Botox therapy in such patients who have failed medications, but also to consider it early on. So there's no point in waiting and seeing if things will improve. Rather, going at it early on is considered to be best served for the patient. And what we do with Botox is we target about 7 muscles in your scalp: the temples, the top of your head, and the back of your neck. These muscles are actively involved in contraction after a pain signal crosses the brain and comes to your face, and they cause the headache. What we do is we select certain points in each of these 7 muscles, and we inject a little bit of Botox in each muscle, totaling about 155 units, and paralyze them or weaken them to a certain extent so that they do not contract in the way that they do in normal people. And this leads to a reduction in headache intensity as well as over a period of time in headache burden. You get a total of 4 injections over a period of 1 year, every 3 months, and at the end of the year, if you do respond to this medication, you will have a reduction of about 60% of headaches. That means if you were having about 20% or 20 headaches a month, you'll be down to about 8 or 9 headaches. This is not an acute therapy. This does not take your headache away overnight. You have to be patient with this therapy. It takes a while to build up in your system. It usually has very few side effects, if any. It does not interact with any other medication, so you can continue your medical therapy along with the Botox. And it usually takes less than 10 minutes in the clinic. And it has shown to be very effective in patients who have failed every other therapy. And so this is where we stand with new treatment regarding Botox. And I'm going to open it up to questions, Katie. And there are some things I'm sure I missed during this presentation, but through the questions we'll be able to get to these as best as possible.
Absolutely. We do have some questions already coming in, and I want to remind everyone how you can submit your questions for Dr. Kaul. You can tweet us at SSMSTL. You can also post a question on our Facebook wall, YouTube, or Google Plus page. And we also have an email address this evening, ssm@ssmh. It's AskSSM@ssmhc.com. So let's get to some of those questions. We have a question from Carrie in St. Louis. Carrie wants to know, talking about triggers. She says she's always been confused about triggers. To me, a trigger means that if it causes a migraine, it has to happen all the time. Sometimes she eats nuts and she'll be fine. Other times it'll cause the migraine. Does that mean nuts are really a trigger for her when it comes to migraines?
Short answer, yes. Nuts can be a trigger for her, and it doesn't have to do it every time. But if she can eliminate nuts from her diet, and if she knows definitely that most times, and I'm saying a majority of times, nuts will cause headaches to her, she should try to eliminate certain type of nuts from her diet. This might reduce her headaches. It, of course, may not eliminate all of her headaches, but it might reduce the headaches to a certain great extent. And every person has different triggers in them, but a trigger need not cause a headache every time.
Another question coming in from Agiru from Uganda, Africa. This is also about triggers. You mentioned sleeping and getting the right amount of sleep. He says when he oversleeps, he actually starts feeling a headache come on. Now, could that be a trigger as well?
Sure, and I really want to stress this because whenever I talk to my patients, Katie, I always tell them that sleep is very important for them. Not only the amount of sleep, but the time of sleep. Sleep hygiene is something that I always stress to all my patients. So what is sleep hygiene? Is going to bed at the same time, no matter what time you go. If you say I go to bed at 11 p.m. every night, go to bed at 11 p.m. every night, but then go to bed at 11 p.m. every night. It's not like you're going to bed at 1 o'clock at night and going to 6 p.m. another night. That throws your body entirely off of your sleep cycle. The other thing is to sleep well. So length of sleep is not important, but the quality of sleep is very important. So if you tell me I sleep for like 16 hours, but you're getting up every 2 hours in that sleep, that's not good quality of sleep. Again, oversleeping is also important. What people mostly, when they oversleep, is when they have lack of sleep throughout the other days. Usually nobody ever oversleeps unless they have a lack of sleep. So what people do is they don't sleep all week long because they're working hard and they're working late hours, and then say, well, I'll just oversleep on the weekend. And what tends happening that they get headaches over the weekend, and that weekend is short. So once you get sleep deficit, which is the deficit you have when you don't sleep well, that can never be made up. And sleep experts have written tons of articles on this, that just because you sleep extra on the weekends, you can never make up the sleep deficit that you get. So try not to oversleep, try not to undersleep, but try to maintain a good quality of sleep. So if you get 5 hours of sleep, and that's what you may need, get 5 hours of sleep every night, but keep it under a strict regimen. A brain is like a 4-year-old child, Kate. You need to keep it in a regimen. If you don't give it a clear regimen, it's going to go out of hand, as you already know.
That makes sense. A question from Wendy in St. Louis. She asks, when you have a migraine, should you go to a dark room to help get relief, or is that just a myth?
Going to a dark room, a lot of migraine patients do go to a dark room. That's for different reasons. Some of them have got light sensitivity, so they have to go into a dark room because bright lights bother them or increase their headaches. And secondly, most migraine patients will benefit from sleep. We call it sleep benefit of migraines. And of course, if you want to go to sleep, you have to be in a dark room. And so yes, it always benefits to be in a dark area. I have a lot of patients who have bright lights at their workplace, and they use dark glasses at workplace because the fluorescent light bothers them. I have had patients who get bothered by the computer screen light that comes in, and there are certain special glasses that are made that can help reduce that glare to reduce your headaches. So yeah, darkness or reduction in light around a migraine patient does help.
All right, Cheryl just emailed this question. How long has research with Botox been happening? And talk about those side effects, if there are any, and how long they last. Are there any long-term side effects, or is it a pretty short-term type of thing?
So research with Botox is ongoing, by the way. So people are still looking into various methods of improving it. But really, the actual research happened about 4.5 years ago by a physician up in Oregon, and she was a neurologist, and she decided to test this on her patients, and then she went to the company who actually did the phase 3 trials. Side effects for Botox, now you have to remember there's good and bad with everything. So the good part of the Botox is that it doesn't get into your system, so it doesn't cause the typical side effects that you get with the other headache medicines, for example, nausea, dizziness, drowsiness, lack of IQ, because some medications can reduce your IQ, loss of hair, weight gain. So all these side effects are non-existent with Botox. However, there are certain side effects that can happen with this medication. It is a toxin after all. You can get immediate side effects are sometimes, if it's not injected in the right way, you can get a drooping of the eyelid, you can get weakness in the neck, but those are technical side effects. So if you have a person who's doing it well, these never usually happen. And I can tell you, we have done over 200 patients in my clinic, and we've never had anybody have drooping eyelids, nausea, vomiting, or even any other side effects that we've reported. The most common side effect that I get in my clinic is sometimes right after the headache, because of the sensitization of the needles, you can get a little bit extra headaches just for a few days after the injection, and then it kind of settles down. That's really what I have experienced. But in terms of disclosure, yes, you can get side effects including nausea, vomiting, bronchitis, and other issues depending on where the Botox is done. And you have to also remember that Botox is used for many different purposes, just not headache. So when they put those side effects in that insert that you read, or when you do research, they're listing the side effects of every possible use of Botox. And you have to remember, when we do it for headaches, we are far away from any important organs. We do not get inside your head. It's outside the skull. So it's very little opportunity to cause any major or irreversible harm with this. However, I would urge you to talk with your doctors before you actually go ahead and do this procedure every time.
Any activities you tell your patients off limits after they get the Botox done?
No, there's no restrictions. You can drive. It doesn't make you drowsy. Like, for example, if I give you Imitrex, I have to tell you, you might get drowsy. I have a lot of nurses who come in and get the Botox. They go right back to work. I have a lot of people who come from their offices, get the Botox in 10 minutes, they're back at their work. So really no restrictions at all.
Another question coming in, Sarah from Loganville, Wisconsin wants to know, she says she gets migraines that she believes are hormone driven since she gets them at the same time every month. Is there something she can do to prevent them rather than just treat them once she gets them?
Yes, and this is a very common issue, especially with 3 times as many women getting headaches, and menstrual migraines are very, very common. Some people just deal with it, and some people would like to have prevention. Unfortunately, there's not a single management for these kind of headaches. However, there are some tips and tricks that I have used in my patients in the past. One of the things that I tell them is like, since menstrual cycles are regular, and you do know when your next one is going to come, and if they are totally restricted to your menstrual cycles, what you can do is take an anti-inflammatory like an Aleve or excess strength migraine or a indomethacin or some kind of medication about a couple of days before your cycle is about to begin, and that will reduce not only your PMS symptoms, for example, bloating, irritability, etc., but they can also cut short the migraines that you get. The other medication is a frovatriptan, also marketed as Frova, Frova, and you can speak to your doctors about this. This has been specifically tested for menstrual migraines, and it has worked to a relatively great extent. Other than that, just kind of drinking plenty of water, preventing dehydration, sleeping well during those days. That usually, again, those are trigger modifications, like I said, lifestyle modifications, like I call them in my clinic, that you can do to help prevent these. But no, there's no specific treatment as such for this.
Another question along those lines from Rachel in St. Louis. Rachel says, I've had migraines since I was 21. Now I'm 31. Recently had my first child. My migraines went away completely for those 9 months I was pregnant. Now they're back again. I'm guessing it could be a change in hormones. Could that be it? And do you have any suggestions for her?
Yeah, so pregnancy is a hormonally different condition, and a lot of people will either get more migraines or they'll get no migraines during pregnancy. It's a 50-50 split. And it's very funny that she asked this question, because I had a patient once come and tell me, he said, Doc, you need to treat my headaches because I can't be pregnant all my life, because she used to get no headaches while she was pregnant. So, and yes, hormonal changes like menopause, puberty, pregnancies, and menstrual cycles will affect your headaches. Only thing I can tell Rachel is that now that you're done with your pregnancy, obviously during pregnancy we cannot treat your headaches with medications. But your headaches are back, and it's a good thing that you don't have any migraines during pregnancy, because that's one less thing you need to worry about during pregnancy. But now that your headaches are over, you can get back with your neurologist or your primary care physician and see if there is any medicines now you can get on to treat the headaches. That's about the extent of that advice I can offer at this point. Also remember, if you're breastfeeding, or you cannot take some of these preventive medications, because they do get excreted in the milk and they can cause problems to the infant. So ideally, I like to start off treatment after you stop breastfeeding, and we can start her on medications. But there are other options that you can do while you're doing that. And so.
That pretty much was the next question. Kanisha just emailed, and she wanted to know, she is near the end of her pregnancy but is planning to breastfeed. Is there really any medication she can take while she's breastfeeding, or does it need to be all alternative therapies at that point in time?
There are plenty of acute therapies that she can take. For example, anti-inflammatories like Aleve, Excedrin migraine. Some of them have caffeine in them, which can be excreted in the milk, so you have to be careful about that. But none of these medications can actually cause any irreversible harm to the infant. The prophylactic medications, the long-term medicines like Topamax and Depakote, these are really a no-no during pregnancy. So because they can affect the brain of the infant, so when they're growing, we do not want them to be taking these medications. So the prophylactic therapies are out of the question. But for acute therapy, you can discuss with your physician, and depending on what your needs are, they can decide on whether to give you medications like narcotics or anti-inflammatories or anti-emetic medications, for example, Reglan, Compazine. Those are often used right after pregnancy when we're breastfeeding, and even during pregnancy in certain trimesters.
All right, well, we're getting a ton of good questions in. I do want to remind everyone how you can send us those questions. You can email us. The email address, AskSSM@SSMHC.com. You can also post on our Facebook wall, also Google Plus or YouTube, or tweet us your questions. Our Twitter handle is @SSMSTL. Okay, Terry from St. Louis just posted on our Facebook wall with this question. She wonders if Botox injections are painful. I'm wondering as well.
Yes, they are painful. There's no way of getting around that, and that's perhaps the biggest drawback of this treatment, and is that they are painful. They are injections. However, I will say this, that I've done a lot of patients who absolutely swore by not doing anything with needles, and they did the Botox and they were fine with it. You have to ask yourself the question: is that what is better, being in pain for 5 minutes in a clinic, getting this therapy, or having a chance at beating those 30 headaches that you're getting every day of the month. So, eventually the risk and the benefit of a treatment is what determines whether the treatment helps you. And I had a question, I think, from some patients like, is it cost effective? If efficacy of a treatment depends on how it helps you. If it helps you, then definitely any treatment, no matter how expensive it is cost effective. However, if it doesn't help you, obviously it is not. But yes, there is pain, and there's no way we can mitigate that pain. There's no analgesic, no lidocaine, nothing we can give for this. But the needles are absolutely thin. The amount of injection that we do is about 0.5 of a mil. It's very little, and the whole procedure is over in 8 minutes or less. And so it is almost like getting one of those vaccination shots where the nurse tells you to look at one side and it's over. It's over. It is painful, but I've had patients coming back now for the 6th and 7th round of injections, and I can tell you if this was painful and not effective, people wouldn't be coming back for this.
That's a very good point. Cheryl just emailed us asking, is Botox a toxin, and if so, does it show up on blood tests?
That's a very excellent question. Yes, it is a toxin, but it is a genetically modified toxin to be compatible with healthcare. And no, it does not show up on any blood test. For example, I think she's wondering about whether, like for controlled substances testing, it doesn't show up because very little of it actually gets into your bloodstream. What it does is it's a chemical or a protein that actually gets into your muscles and combines with the DNA of your muscles to reduce the proteins that cause the muscles to contract. So it actually just stays locally, 99% of it. Of course, some of it does get into the blood, but it very rarely can show up as a controlled substance in one of the testing.
A question from Darius. I've had migraines for 20 years, tried every medication under the sun. He is allergic to Imitrex. Would he be a good candidate for Botox?
Yes, like I said, if you have failed 3 or more different medications in 3 or different classes, meaning you've tried an anti-seizure medicine, you've tried an antidepressant, you've tried an Imitrex, and you've had headaches for more than 3 years, or actually it's even 6 months, and you're having more than 15 headaches a month, yes, you do qualify. Again, just because you qualify doesn't mean you can get the therapy. It is a detailed discussion that we have in the clinic, and we have to look at other contraindications. For example, if you're on blood thinners, that's some of the contraindication. You cannot get an injection. Some people will do it, some people will not. For example, if you have muscle diseases, for example, myasthenia gravis, or if you have autoimmune muscle disorder, you cannot get this medication. So there are certain contraindications to getting this therapy. So just because you qualify, if you think that you are there, I would have a frank discussion with your primary care physician, or go to a neurologist who does this and have a discussion with them whether he can actually get it or not.
A question from Amy in St. Charles, Missouri. I heard there was a headband recently approved by the FDA to treat migraines. What is this, and how effective is this? Have there been any real-life success stories?
Yes. So this band that she's talking about is a band called Cefaliband. It's spelled as Cefaly. If you look it up on Google, you can pull up their website. It's a Canadian company. It was approved by FDA in Canada and in the US about 6 months to 8 months ago. It only became available in the US a few months ago, as per my knowledge. It is not approved by insurance companies. It's pretty expensive. It costs about $500 per treatment, and you have to pay out of pocket for it. And as you can imagine, not many of my patients can afford it at this point. However, I did have one patient who could, and she did take a script from me, and she is going to go ahead and use it, but I haven't received any feedback from her yet whether she's received it or not. Keep look out for our regular updates. Maybe we'll put it up on the Facebook website or something like that if we come up with an update regarding that. Yeah, but this is a new therapy. It is relatively very new here in the U.S. I don't think a lot of patients have tried that, but as we go along, we might find more things about it. I'm hoping that it works.
Yeah, we'll definitely check back with that one. Kenzie wants to know, she says her chiropractor said that laying on her stomach while sleeping contributes to headaches. Do you think laying on your stomach puts things out of alignment and causes headaches?
I don't know if laying on your stomach specifically does that, but sleep posture is something that I always discuss with my patients. For example, people can have primary headaches and secondary headaches. And we didn't touch upon this in the slideshow, but I would like to talk about that. Secondary headaches are headaches from any other cause other than migraine. So for example, I have a migraine headache, but I also have discs in my neck that are bulging. So that would cause neck pain. And so I have what is called as a secondary cervicogenic headache, meaning headaches coming from my neck and going upwards in the back of my head and then causing headache. So if I can take care of that, then maybe it'll reduce some of my headaches. So sleep posture is very important. So for example, when you sleep at night, if you're tossing and turning continuously, your muscles are never at rest. So that causes stiffness in your neck muscles and back muscles that can be, prolonged headaches. Secondly, the pillow you sleep on, the mattress you sleep on plays a very important role in sleep posture, and chiropractors will tell you that as well. And if you're not sleeping on a pillow that supports your neck well, you may end up having neck stiffness that may contribute to your headaches. Because remember, neck muscles are one of the muscles that we do inject in Botox therapy. So they have been identified as one of the muscles that do, contract during headaches. So if you're not keeping your neck muscles happy, your head is not going to be happy.
That makes sense. We all know insurances are different with what they're going to pay for, what they're not. Carrie emailed us wondering how expensive Botox treatments are if you're going to pay out of pocket.
Right now, it is very prohibitive to pay out of pocket because it is a very expensive medication. It costs upwards of $3,000 a treatment. That is depending on what kind of rate your insurance has negotiated with the company. Out of pocket, it may cost even more. However, having said that, there are a lot of reimbursement solutions that are run by independent companies as well as by Allergan, who is the company that makes the Botox. So if you're a person with, first of all, if you have insurance, it gets covered. Now, this is for people who don't have insurance or who do not have adequate insurance. If that's the case and you're interested in getting Botox, I would call my office or call your neurologist's office and ask them what are the solutions. And there are various reimbursement solutions where Allergan will pay up to 99% of your cost if you qualify for certain things, and that depends on your income criteria, requirements, etc. So again, that's a little bit of expansive topic to touch here, but just because you don't have insurance doesn't mean that you may not get Botox. So I would talk to your doctor and see what options are available.
Mary from Missouri wants to know, is there a cure for migraines, and is it possible that beta blocker medications work to control migraines?
Sure. Beta blockers are often used for migraine headaches, and one of the commonly used drugs is Inderol, and Verapamil is another blood pressure medicine that has been used. And I have plenty of patients who just take Inderol, and they do pretty well with their headaches. I forgot, what was the first part of the question?
Is there a cure for migraines?
There is no cure for migraines. So it is a chronic disease, but then there's no cure for diabetes and hypertension as well. So you have to remember, chronic diseases can only be managed. They cannot be cured. And so short answer, there's no cure. That doesn't mean that you have to suffer with it.
Another question from another Mary in St. Louis. How does Botox work to actually treat your chronic migraines? What does it do?
That's a good question, actually. A lot of neurologists have asked that question too. And to be frank, I don't think we completely understand the mechanisms. But one of the hypotheses or one of the ideas that most neurologists believe in is that, first of all, it weakens the muscles in your scalp and head. So when you do get that pain signal that comes from within your brain, it triggers these muscles to contract and thus stretch your scalp and cause that pain. And so when you are taking these muscles out of the equation, so you get one component of pain signals out of there. So no matter what signals you're getting from within your brain, these muscles will not contract. And if these muscles don't contract, your intensity will go down and your pain will go down. Now, you will say, well, how does it remove headaches completely? So one of the ideas that neurologists have is feedback mechanism. So like remember I told you, Kate, that brain is like a 4-year-old boy, or a girl. It actually believes in feedback. So when the brain sends out pain signals, it is telling you something is wrong. Okay, but the way it gets feedback is by these muscles contracting. So brain sends a pain signal out, the muscles contract, it gets the feedback. The head says, well, okay, I got a response. However, once you get Botox, the response doesn't come back because the brain is saying, well, I'm sending these signals out all the time, I'm not getting any response. So eventually the pain signals will stop coming. So lack of feedback always destroys the loop. So feedback is a very big loop. So when you For example, if I put somebody in a seat and I keep hitting him every day and he doesn't respond to me, eventually I'm going to get bored and walk away. And same thing happens with the brain, with these pain signals. So that is one of the ideas, and so that's how it helps prevent these headaches, because you're taking one important aspect out of the pain cycle out.
A question from Vicky. She wants to know, do migraines always have to happen in the same place, or can they change where in the head they're occurring? She says her husband's getting daily headaches, but they aren't always in the same place. Would Botox work for him?
Sure. So there's two different aspects of the question. One is, would Botox work for him? That has to be decided based on his clinical story. So how long has he had the headaches? So what has he tried? Those kind of things. The first part is totally unrelated. This is basically where headaches can occur. Essentially, headaches can occur anywhere, and there's no predictability to it. I have patients who sometimes have it on the left side, sometimes it happens on the right side, sometimes it spreads to the other side, and that makes headaches even more frustrating, is because you don't know what's going on and which headache is a dangerous headache and which headache is a normal headache, and that makes headache management itself very frustrating, and it's frustrating with the patients because they don't know what's going on. It's like, is this a migraine? Is this not? But to summarize, when you get the pain signals, these signals are not uniform. They don't come out of the brain in a single fashion. So you might get left side activated more than the right side. So you might get one day headaches more on the left side. Some days you might get headaches on the right side. It doesn't really change the diagnosis as much depending on which side it is. Now, if you get headaches only on one side of your head all the time, that is a red flag, okay? Because that might mean that you have something going on in your brain, like a growth or some kind of a tumor or a stroke, that needs to be looked at. Now, it still could be a migraine, but usually migraines don't restrict themselves to one side. So if you are having headaches unilaterally on one side every day of your life, or 5 or 10 times a month, you need to get that checked out from your physician.
Let's talk a little bit, you mentioned this earlier, but let's talk about the initial consultation, and then you do decide a patient is a good candidate for Botox. That first injection, you said, that appointment can be 10 minutes or less. When's the next time they're coming back in, and how many more times will they be coming back in for the Botox injection?
That's a great thing to touch upon. So, your first, when you come into my clinic as a new patient, you get a 1-hour consultation where we discuss everything from your habits, to your triggers, to your family history, and to the location of the headaches and the type of management that you're using. That's your first appointment that you get. In that appointment, we decide whether Botox is appropriate for you, or would there be more appropriate medical management that needs to be done before we get there. Once it's decided that you get Botox therapy, we fill out a couple of forms in our office, and then typically it takes about 3 or 4 weeks for them to get approved. Because it's an expensive medication, it needs to go through the proper channels. Once you get approved for the Botox, you come into the clinic and you get the medication in a series of injections on that day, and then you visit with us 1 month after that injection. Usually 4 weeks is where we see maximal effect of that first injection come in, because it takes about 7 to 10 days for the Botox to start acting on your muscles, and then it lasts for about 2 to 4 weeks after that, and then it starts to taper off 2 to 4 weeks after that. So that gives you that 3-month period. And then you visit me again 3 months from the first injection, then again a month after that, then 3 months after that. So a total of 4 injections over a period of 12 months. If usually after the first 2 injections you don't get any relief, we kind of evaluate whether this patient whether you're responding to it or not. And like with any medicine, you may not respond to this medication. It's not 100% medication. So that's why the follow-ups are required. And also, I also tell all my Botox patients to keep a very strict headache calendar so that we can see a tapering down of your intensity and frequency. Typically, after the first injection, what I usually see is a decrease in intensity rather than the frequency. So if you're getting 20 headaches at 10 out of 10 each headache, you might still get 20 headaches in the next month, but they might become more like 4s and 5s. So you can get through the office or through the day or taking care of your kids or going to soccer games, whatever, better than with a 10 out of 10 headache. Then with the next subsequent injections, you'll start to see a decrease in your frequency as well as intensity. And to what extent you respond to it, it depends on your personal makeup, like with any other medicine.
We have a post on our Facebook page wondering what type of physician should be administering these injections.
Usually a person who's well trained in these, but definitely. for the reason I mentioned is that there are a lot of technical side effects that can happen with Botox if not administered in the right way. So somebody who has done a lot of injections, first of all, and who's trained adequately in getting these injections in the paradigm for headaches. Now there are a lot of people who do Botox for various reasons. For example, cosmetic purposes, or for movement disorders, like for example, dystonias. So somebody who has done headache injections prior and is trained in it should be an ideal person to inject it, and he would know exactly where to inject in the right way so as to not to cause those technical effects, because those can be debilitating. If you get neck muscle weakness or eyelid droop, those can be very disfiguring and disabling.
Quite a few emails coming in talking about some of the side effects, not Botox, but medicine for migraines, making you gain weight. Is that a side effect from some of these migraine drugs, and are there any you would recommend that doesn't have that side effect?
So initially when I talked about the slides, I did tell you that when we give daily medications, we decide on what the patient's needs are, and then we decide which medicine. So I can give you an example. For example, if I have a patient who's slightly overweight, who really does not want or cannot do with any more pound increase, then in that case I would prescribe Topamax, because it is one of the medicines that actually can cause you to lose weight, or at least will not cause you to gain weight. So that would be an option there. However, if there is a person who's not worried about weight gain but has got sleeping issues, I would prescribe more antidepressants for him, because if he has got a lot of stress or depression or lack of sleep, because it helps regulate your sleep, at the same time helps with your headaches. So yes, almost every medicine that's given for headaches besides Topamax will cause you to gain weight. Now, a word of caution is that it's not that these medicines will cause you to gain weight no matter what you do. So if you're a slim, athletic person who does exercise 3 hours a day, and you're like in aerobics every day, and you don't gain weight, it's not that if you get these medicines that you will become bloated up. But this is more for people who are predisposed to gaining weight, who are already overweight and cannot afford to gain weight. That's where it increases the appetite center of your brain, so you eat more, and also you tend to become, you tend to gain weight at that point. So again, it is all dependent on what the patient needs are. So when I see a patient in the clinic, there's no rule book for these medications. So I usually discuss with the patients all the side effects, and then see where they want to go depending on how bad their headaches are. Now, some people's headaches are so bad that they don't really care about gaining weight because they want these headaches to go away. But some people are very sensitive about weight. So it all depends on how your needs are, and how far you want to go to really get rid of these headaches.
Cheryl emailed in wondering, does the Botox permanently paralyze or weaken your muscles?
That's a good question, and short answer, no, it does not. That's why you need to keep coming back every 3 months to get it, and that's why cosmetic Botox, people go in for every week. No, this medicine wears off typically in 8 to 12 weeks. You have to keep coming back every 3 months. There is some cumulative effect, and just to a word of a point to make here is that most of these muscles that this toxin gets injected in are not used for anything specific. For example, except the neck muscles, all the other muscles that are injected are vestigial muscles. They are muscles that we used to use when we were, ape men, when we used to eat uncooked food. We needed these muscles to chew and grind our food. Now we don't need them anymore. They're almost like the appendix. We don't need them, but they keep lying around, and you don't realize them until you get an appendix, inflammation. So even if these muscles did become paralyzed completely, you will not notice any change in your expression or functioning. But they do not.
All right. Jesse emailed in asking, now Dr. Kaul, you mentioned a few times having headaches 15 times a month. That can make you a candidate for Botox. When you say 15 times a month, are you talking about normal headaches, or do they have to be a full-on debilitating migraine in order to be a candidate for Botox?
So again, I come to my point, which I've phrased before, is there's no such thing as a normal headache. I often get this from patients like, oh, I just had headaches, regular headaches. And I don't really know what regular headaches mean. You would never say that about a stroke. I had a regular stroke, Yeah. So really, headaches are often dismissed by patients and clinicians. It's not just the patients. Often clinicians will dismiss headaches as just being normal. If you're having a headache 15 times out of the month, That is unusual. Okay, I mean, I don't have headaches 15 times a day, so that is not normal. So headache is a headache, and if you get one headache in like a year, that's okay. You know, maybe you had a sinus infection or if you're having 15 headaches a month, that is not normal. And really, again, it comes down to what is the difference between headache and migraine. There's not much difference between headache and migraine. Migraine is a classification that neurologists use to study the disease and for using it for clinical trials, etc. If a person comes to me and tells me that he has headaches 15 days of the month, he needs treatment, period. There's no such thing as a normal headache or a full-blown headache. It's the same headache that is dull at times and can be really debilitating at times. And they can fluctuate. You can have a bad week, you can have a good month. So it all depends. For example, last couple of weeks we have had bad weather with this high pressure, this front moving in with a lot of rain, a lot of clouds. This actually triggers migraines. So if you had a bad week, because of these weather, and the rest of the year you get just these dull headaches, doesn't mean you have any less of a migraine than a person who has got very bad. So I really detest this word normal headaches. I think if you have headaches that often, you would not say this about any other disease possible, but you say this for headaches. I really don't, and I think that's the reason why most people go untreated with headaches, because that's what they get from their physicians, that's what they get from their family members, and that's when they get it from their friends. Oh, it's just a headache. But really, it's not just a headache. It's a headache that's preventing you from going out to dinner. It's a headache that's preventing you from socializing. It's a headache that prevents you from seeing your kids at soccer and their plays. It's a headache that prevents you from going to work, that's missing a lot of work, and even getting fired. So these are not normal headaches. There's no such thing as a normal headache. So if you are having headaches that many, please go see a doctor.
A question from Christina. She says her child gets migraines. Is Botox a treatment kids can use?
Nobody below the age of 18 can get it right now. And this is per FDA regulations. And there's a reason for that. And one of the reasons is that children will often outgrow some of their headaches. So really, you don't want to give a child such a treatment unless it is, it persists in its adulthood. Secondly, it is probably too painful for children to bear. Adults have a longer and a more robust pain tolerance, rather, as compared to children. Also, children can move a lot, and this requires the patient to be absolutely still because of obvious reasons. So these are the few reasons, among others, that children should not be getting Botox therapy.
Another question coming in. My son's been suffering now for 4 years with chronic migraines. He's taking blood pressure medicine to treat them. What makes Botox different in its effectiveness than a blood pressure pill?
Actually, there's no study that has been done to compare Botox to various therapies. So it's not, remember that Botox is not replacing any of the migraine therapies. You still have to continue that. It is most often used as an adjunct, meaning in addition to your therapies, we could use Botox to give you additional benefit. The reason for that is that Botox actually doesn't get inside your brain, remember that. So it's only acting on the outside of your brain, while these blood pressure medicines, the seizure medicines, the antidepressants, they actually get inside your brain to prevent the actual mechanisms that are causing this headache. So Botox is different. That's why it's never used as a primary mode of treatment, because it's only to be used once you fail all the other medications. So it is different, but it's not in replacement of that blood pressure medicine therapy. But say if you're taking blood pressure therapy for 5 years, you're still having about 10 or 15 headaches a month, you have tried other medications, and then you talk to your doctor, say, what else can I do? So there are two choices. One is he says, well, you just try the medicines and keep trying other medicines. And the second choice is, well, we can try Botox in addition to your medications to give you some additional relief. So this is very important to differentiate between the two. We do not advocate Botox therapy as a primary therapy first, and second, in lieu of other therapy. You don't want to replace your regular therapy with Botox, but it can be added on to your therapy, and if you have failed therapy, then it can be given to you. So
you've had some huge success stories with Botox. We got a couple questions coming in wanting to hear about some of the success stories from your patients.
Well, we were recently on KPLR 11, and I had two of my patients there who actually interviewed with on TV, and they talked about their success stories. And for example, I have a patient who's a pharmacist technician, headache for 30 years, 30 headache days a month. She had two daughters, one son, couldn't go to their soccer games, couldn't go to their plays, and then she kept getting medication upon medication, which caused her to become slow. Almost she called it stupid and she worked in a pharmacy. That was a real debilitating thing for her because she has to remember medications, and so it was causing problems at her work. And she came to my clinic, and we decided to give her Botox at the time because she had failed already 4 or 5 different medicines and had severe side effects to each of those. And since getting the Botox, she gets about 2 headaches a month. She can now do what she wants to do. She's very happy. She's actually now getting her 5th or 6th injection right now because she wanted to continue because she had so much benefit from it. She's almost afraid to stop them because she feels afraid that she might go back to that point. I had another patient who works for a very big multinational medical firm. She had headaches, a different type of headaches, headaches without aura. And again, she used to travel a lot for her work. So every night she would sleep in a different hotel, and she would have to go, fly overnight to various cities. And as a result, as you would imagine, her sleep cycle was not the best, and she was getting headaches all the time. And we decided to do Botox therapy for her since she had failed all of the medicines. And remember, for somebody who flies, somebody who drives a truck for a living, a lot of these medicines for headaches will cause you to become drowsy and altered mental status. And these guys just can't take the medicines. And that's where Botox can help them because it doesn't do any of these side effects where it lowers your consciousness, it lowers your IQ. Makes you gain weight. All these side effects are non-existent with Botox. So, for example, this lady, she could not take certain medicines because she flies all the time and she couldn't be impaired. And so we decided to do Botox on her. And she's one person. So again, it goes by case by case. So in her case, she didn't have to fail all the medicines. Because she couldn't take the medicines, it was counted as a failure. So she qualified for the Botox. And since then, she's doing well. She's back on her work. She flies all the time. Doesn't have any headaches, and she's done really well. So these are just 2 of the patients, and I have done over 200. We have about close to 180 patients. We've done over 1,000 injections here in the clinic, and I always say to my my staff that Tuesdays, which is the day I do Botox, is my happiest day because my patients are the most happiest that day. Everybody is very chirpy and they're ready to go, and you can imagine how much it helps because nobody is happy to get 31 injections, okay? So only a person that is helping is actually happy to get these injections. And we have plenty of these patients. However, of course, we do have patients that it hasn't helped. And like with any other medication, helping you or not would depend on your personal makeup, what we call idiosyncrasy. For example, if I take aspirin and if you take aspirin, Kate, it might help me more than it might help you, but there's no way to predict that. So the only way to know for sure is to talk to your doctor, make sure everything is, crossed and dotted, make sure you are actually qualified for it, get the injection, because really there's no other recourse for these patients. They have failed every medicine out there. They have headaches for 30 years. I cannot even imagine living with a headache for 30 years. And so, and really when they used to come to me like 5-6 years ago, that I had no other options available. And now I'm so happy that at least I have an option where I can say, well, let's just try this. Why not? And touch wood, it has worked for most patients than not. So, I would say just talk to your doctor, try it out. It's worth it.
Carrie just posted on Facebook, we talked about those migraines that are triggered by the weather. Will Botox help with those headaches? She's found that she's typically resistant really to any other treatment.
And I want to touch one more good point about Botox is it's a downstream medication. So meaning it doesn't really care what kind of headaches you have. It doesn't care if you have a headache from concussion. It doesn't care if you have a headache from past strokes or bleeding in the brain. It doesn't care if you have tension type headache, migraine with aura, because that only comes into consideration when you're actually treating with the prophylactic medications. Because then you got to talk about different medicines helping different types of headaches. Botox basically, essentially, is blind to type of headaches. So it essentially paralyzes your muscles. So no matter why you're getting the headaches, when the pain signal comes out, it's going to contract the muscles in your head, because that's the one way you get headaches, no matter what type of headaches you have. And because that's out of the equation, you're not going to get as severe a headache as you used to get before. So yes, Botox will have the headache because it is blind to what kind of headaches you have, weather-related, any kind. So.
So that goes for hormonal headaches and those triggered by allergies as well.
Right. One caution is that if you, again, you have to have more than 15 headache days a month. When we talk about 15 headaches, a lot of people tell me that they have, say, 8 headaches. But those headaches last for 3 days each. So it's actually what we're talking about is 15 headache days a month, meaning how many days of the month do you suffer from a headache? Just because you have 8 headache days, but actually you're suffering from 24 headache days because each of those 8 headaches lasts for about 2 days. So really what patients should ask themselves is that how many days of the month am I suffering from these headaches? Not how many headaches am I having. So, and that's what I do in my clinic is I ask them, tell me the days, tell me how many headache-free days do you have? Like how many days are you headache-free? And they're like thinking, well, I don't think so. And then that's your answer. You have headaches most days of your life, so you should get this management.
Any remedies to get rid of a migraine without medication? That question just came in.
And we've discussed that with oral medications. So, for example, and I think this presentation will be available, Kate, after this is over. So they can look up the slides, but there's various herbal therapies, acupuncture, physical therapy, biofeedback, trigger management. So yes, I have a lot of patients who absolutely refuse to take medications at all because they believe in holistic therapy. And we work with them as well. It's not like every doctor wants to give you a medicine. If I can take care of your headaches with just lifestyle modifications, most doctors would prefer doing that. And that goes with any chronic disease, for example, diabetes and hypertension. There are a lot of people with diabetes who don't take any medicines. They control their sugars with just lifestyle modifications. There are a lot of blood pressure patients who do not take any medicines for their blood pressures. Same thing with headaches. Yes, it can be done, but you have to come and speak to the specialist.
Last question, how long should you go with a migraine while you're taking a medication and you're still not getting relief?
It depends on what you're trying to get at. So usually I say when I start a new medicine for headaches, I usually go 2 weeks and see if the patient has either side effects or effects. And then at that point, I'll try to make a change. Either make a change in the dose or make a change in the medication. If they have severe side effects, you make a change in the medication. If they have no effect, but there are no side effects and they want to continue this medicine, you make a change in the dose. After typical 2 or 3 dose changes, which will be around a month, you make a change in the medication at that point. So, I usually tell my headache patients to respond to me every 2 weeks and give me an update via email or by phone.
Before we head out, any last-minute tidbits you want to throw out there?
I just want to touch base on, again, that there is no such thing as a normal headache if you have it 15 times a month. Make sure you seek help for these because there's no reason for you to be suffering through these headaches. And although people will say this is just a headache, you have to ask yourself how this headache impacts your life. And one of the tests that we do in our clinic is to ask questions how it impacts your life when you don't have a headache. So, for example, if you don't have a headache today, but you have a friend who calls you up and say, hey, let's go out for dinner. And if you pause and think, hey, what happens if I go to the dinner and I have a headache? If you ask yourself the question, you need to seek help. Because if your life is being affected by these headaches in any way, whether you have headaches or not, it's time to ask for help. And there's no reason. If there's no help for you, people will tell you that. But if you don't seek help, you're not getting it. So ask your doctor, primary care physician, your neurologist, any kind of doctor that what else can be done about this. And that's all I would like to say is that headaches are not trivial. They are trivialized by our society and our social culture, but they are not trivial. They can be dangerous, as we discussed initially, or they can be migraines. There are treatments for that.
Well, Dr. Kaul, thank you so much for taking the time out of your day to talk about a subject that affects so many people. And thanks to everyone who sent in questions, some really great ones. If you're looking for more information about headaches or providers in your area, please visit our website, ssmhealth.com. That's where we'll also post this complete video, and we'll also share it tomorrow on all of our social media channels. Make sure you follow us on Twitter and like us on Facebook. Thanks for tuning in. Until next time, stay well.